Hi, I'm Sue, and today I'm going to chat with you about the benefits of skin to skin. So before we start talking through the benefits, I'd like to just show you what is safe skin to skin. So you can see the picture on the screen. Okay, so we have a little baby there and they're lying on their parent's chest. So they have their tummy to parent, they've got their little nappy on, they have no other clothes on, and they've got their head to the side. Okay, and they have a little blanket over them, keeping them warm. If it's within the first 24 hours of life, we might have them wearing a little hat as well. Once they're 24 hours old or older, there's no need for the little hat when they're indoors. Okay, so no need for the hat with skin to skin past 24 hours. Okay, so if you look at me here, okay, so I have my little baby. Okay, they've got their nappy on, they've got their tummy to me, they've got their head tilting to the side, and the most important thing is I can see them. They're in view at all times, okay? So this is safe skin to skin. So now we're going to chat about the benefits of skin to skin. So some of these benefits are directly to the breastfeeding mum. Some of these benefits are to the new baby, and some of these benefits are to either parent. Okay, so let's talk about them all. So first of all, skin to skin encourages the initiation and the continuation of breastfeeding and helps boost milk production. Okay, so that's a really big one, and that's a big one for baby, and it's a big one for mum. Okay, so when baby's doing skin to skin with mum, baby is close to mum, close to the chest, can often smell the milk, and it will encourage them to initiate that first feed. As well as that, when baby is skin to skin with mum, it's stimulating all those oxytocin receptors on her chest, and that is encouraging that flow of breast milk, because we know that oxytocin really helps that breast milk to flow. And so lots of benefits there for baby, lots of benefits for mum. Another benefit, reduces postnatal recovery time. So we spoke about oxytocin in the labour and birth class. We know oxytocin encourages your womb to contract. So when baby does skin to skin with you, all those oxytocin receptors are triggered. We start producing oxytocin. It encourages our womb to contract. We go back to our pre-pregnant self a little bit more quickly. It reduces our postnatal recovery time. Another benefit there you can see is that it regulates baby's heart rate, their breathing, and their temperature. So this is a benefit for baby, and it doesn't matter who baby's getting skin to skin with for them to reap this little benefit. So either parent doing skin to skin will have these results. So it regulates baby's heart rate, their breathing, and their temperature. And the way it does this is when baby's skin to skin, they're very calm. Okay, skin to skin is a very calming activity for baby. And when they're calm, their heart rate steadies and their breathing steadies. Their temperature, okay, so when they're skin to skin with you, your temperature radiates to them, keeping them nice and warm. Babies in the first 24 hours of their life in particular, they work very, very hard to keep warm because they're used to being in an environment that's 37 degrees, and now a warm room for them is like 18 to 20 degrees. Okay, so they work very hard to keep warm in the first 24 hours. And when they're doing skin to skin with you and you're helping them out a little bit, that's going to reduce their expenditure of energy. So that is going to result in maybe not as much normal physiological weight loss. And it's also going to normalize their blood sugar levels as well. So they're less likely to have low blood sugar levels, which is a huge benefit, especially to those babies who are born from mums that were experiencing gestational diabetes. Okay, so huge benefits of skin to skin for baby in terms of heart rate, breathing, temperature, and blood sugar levels. Skin to skin strengthens baby's immunity and reduces their infection risk. So let me explain. So when baby's born and placed up on your chest, baby's going to be exposed to all the good bacteria that lives on your skin. That's called your microbiome layer. Baby's going to do an hour of skin to skin with you, and they're going to really soak up all that good bacteria. The idea is then that baby will do skin to skin with your support person or their other parent who quite likely has a different set of good bacteria to what you do. So baby's then going to be exposed to their good bacteria. So baby now has good bacteria from mum, good bacteria from partner, and what we're going to do is not bath baby for at least 24 hours, and we're going to let all that good bacteria colonize or build a home on baby's skin, and that is now baby's layer of good bacteria, or baby's microbiome layer. So a little bit of both parents. And it's that microbiome layer that builds towards their immunity and it reduces their infection risk. Skin to Skin also supports good sleep cycles for baby's brain development, and it promotes bonding, helping babies feel happier and cry less. Skin to Skin combats postnatal anxiety and depression. So when baby's doing Skin to Skin with either parent, the Skin to Skin will stimulate oxytocin receptors, and oxytocin is one of those feel-good hormones. Skin to Skin improves baby's digestion, reducing feeding discomfort and encouraging weight gain. Okay, so how does all that work? So, well, I suppose when you think about it, baby is so calm and happy in Skin to Skin. They're not one bit stressed. Think about what happens when you're stressed in terms of your digestion. So for example, if you had your breakfast and you had like a big interview at 12 noon, the likelihood is at like 12 noon, you're still feeling your breakfast in your tummy because you're so stressed. And when we're stressed, we do sometimes suffer from indigestion. If baby's doing Skin to Skin and very calm and chilled, it does help them digest their food and reduce any discomfort associated with it. Helps with weight gain because they're not burning up as much energy, keeping themselves warm. So Skin to Skin also accelerates baby's brain growth and supports early cognitive development. And the reason for this is because Skin to Skin is one of the very few things that our new baby can do that will stimulate all 5 senses. So when baby is in Skin to Skin, you know, they can hear your heartbeat, they can smell you, they can smell the milk. Vision, so we know they can see for 8 to 10 inches, so they can see you. They can taste the milk if they're feeding, or sometimes you do catch them licking on your skin, and they can touch. You know, they're Skin to Skin with you. They've got their little hands out as well, having a little feel around, getting to know their environment, getting to know you. So loads of benefits of Skin to Skin there.